A very good morning to our lecturer, Madam Sham. I'm Esther, and my group members are Nadira and Erica. The topic for our presentation today is laryngeal cancer. So first of all, let's start with the content outline. So the content outline of our presentation including introduction, definition of laryngeal cancer, and also etiology, pathophysiology, clinical manifestation, the important investigation, treatments, complication, nursing care plan, health education, and also conclusion. So first, let's start with the introduction. So human larynx, also known as the voice box, is a part of our throat which located superiorly to the trachea, which is also known as the windpipe, and the esophagus. So there are three main parts of our larynx, which is supraglottis, the upper part, glottis, middle part, which containing vocal cords, and subglottis, which is the lower part. So you can look at the diagram on the right side. The location of the larynx, yeah, basically is above the trachea and esophagus, and the parts of it including epiglottis, supraglottis, glottis, and subglottis. So larynx is a cartilage encased organ and plays a significant role in breathing, swallowing, and talking. So now let's talk a little bit more on the function of the larynx. So first, during breathing, the larynx will close and open naturally like a valve to allow air to flow in and out of lungs through the trachea. Second is the glottis, which is the part containing vocal cords in the larynx, will vibrate for speech production. That's why I can talk like now. And third is swallowing. So during the swallowing process, a small flap called epiglottis will cover the opening of the larynx, playing a crucial role of preventing food and liquid form entering the airway. So based on the World Cancer Research Fund International, oral cancers including cancers of the lips, oral cavity, hypopharynx, oropharynx, and larynx are the most common, with more than 377 and 700 cases worldwide in 2020. It is based on the result from WCRF International 2022. So next, let's go into the definition of laryngeal cancer. So it is also known as cancer of the larynx or laryngeal carcinoma. It develops due to the abnormal growth and proliferation of cells, and it forms in the tissues of the larynx. So you can look at the diagram. The left side is basically the tumor made because of the abnormal growth and proliferation of cells. So laryngeal cancer is also characterized as a type of neck and head cancer due to its anatomical location and potential to metastasize to thyroid, trachea, esophagus, and it also can spread to the regional lymph nodes in the neck, as well as the distant sites, including the carotid artery, upper spine, the chest, and to other parts of the body. So, from this information, you can understand that laryngeal cancer is not only a cancer that will occur in the larynx, it can spread to other parts of our body as well. So next, let's move on to the etiology. So the exact cause of the laryngeal cancer is still unknown. However, there are few risk factors which can increase the risk of getting laryngeal cancer. So among the listed factors, tobacco and alcohol are the most dangerous factors. That's why I put them in the red color up there. And the rest will be fumes, the prolonged exposure to fumes, chemicals, dust, or the causes of chronic laryngitis, secondhand smoke, straining of the voice, and also overweight. So for extra information, like people with nutritional deficiency, genetic syndromes, or weakened immune system will also increase the risk of getting laryngeal cancer. Next, let's move on to pathophysiology of laryngeal cancer. So, how laryngeal cancer can happen in our body, or and after it happens, what is actually going on? So, in our body, the cells will grow, divide, and eventually die. This process is controlled and supervised by the genes in the cells, also known as the DNA. So there are two important genes which control the body cells activities. First is proto-oncogenes. So this genes is to promote cell growth and survival. The next one is tumor suppressors tumor suppressor genes. So this is the genes that control cell growth and ensure cell apoptosis at the appropriate time, which means it let the cell die at the right time. However, with the etiology of the risk factor that I mentioned just now, which are the carcinogens, the genes in the DNA in the cells will become mutated. So when the DNA mutated, the normal cell development will become abnormal cell growth, which is the proto-oncogenes will be mutated and activate oncogenes, and tumor suppressor genes will be deactivated, which means either one of these will lead to abnormal growth and proliferation of the cells, which can lead to the cancer. Okay, next is a little bit more on the pathophysiology of the laryngeal cancer. So, in a case of laryngeal cancer, the genetic mutations begin in normal larynx cells, like the tobacco, chemicals, or prolonged exposure to alcohol will increase the risk of genetic mutation. And then the mutation happen in the cells in the larynx, developing anywhere in the larynx, resulting in benign conditions, which is chronic laryngitis or vocal cord nodules, or the benign tumors like vocal cord polyps. This benign conditions is not cancerous, however, it can disrupt the normal architecture and function of the tissue or the organ. However, in some cases, this mutation can also lead to precancerous lesions such as leukoplakia, which is white patch-like lesion. You can look at the diagram down there, the left side, or erythroplakia, which is the red macule or plaque within the laryngeal mucosa. So although they are not yet cancerous, but if we leave it untreated, this precancerous condition can become cancerous or cancer, which eventually lead to laryngeal cancer. Once the tumor is formed, it has the potential to metastasize to distant parts of our body, such as lungs, liver, bones, via the lymphatic system and blood circulation, and it will cause a lot of
Hi, good
complication.
morning. I'm Nadira. So I will present about the clinical manifestations, investigation, and treatments for laryngeal cancer. So first, we will look into detail for the clinical manifestations. So the most common symptom of laryngeal cancer is having a hoarse voice that does not improve and is mistaken for a cough or cold. So other symptoms such as sore throat or cough that doesn't improve, dysphagia, lump in the neck or throat, dysphonia, which means voice changes like hoarseness that doesn't improve or worsen after 2 weeks, and then ear pain. However, patients should seek immediate medical attention if they experience the following clinical manifestations. So the first one is dyspnea, which is difficulty in breathing, noisy and high-pitched breathing, or we call stridor, global sensation, and coughing up blood. Okay, next is investigation part. So when a patient complains of having symptoms similar to laryngeal cancer, the physician will examine the inside and outside of the throat for any swelling to check for any lumps. So the diagnostic investigations are performed to confirm the patient's diagnosis. So first we have nasondoscopy. This procedure is done to view the larynx of the patient. Next is laryngoscopy. It is the second line of investigation done to view the larynx of if nasondoscopy is failed to perform. And then biopsy is a removal procedure of tissues or cells from the body for patient's diagnosis. So there are two types of biopsy. The first one is endoscopic biopsy, which is the removal of tissue samples from the larynx during direct laryngoscopy. And then we have fine needle aspiration, which is a biopsy of a lump in the neck or enlarged lymph nodes. Okay, so for this part, I include some of the pictures of how nasondoscopy and laryngoscopy are performed. Okay, so next, the physician also ordered CT scan and MRI to determine the size and location of a tumor and its level of spreadability. However, MRI is not necessary for early stages of the cancer. And then next we have the barium swallow. So barium swallow is a procedure performed to detect abnormalities in the throat when the barium is swallowed. And then we also have X-ray. So the doctor may order X-ray to determine any metastasis of the lung. Okay, so for the last part of the investigation, we have PET scan. So the doctor may recommend it to the patient to find cancer that has grown or metastasized to the lymph nodes in the neck or other organs. And then we have speech and swallowing test. It may be necessary to examine the condition of larynx and gag reflex. And then lastly, we have the blood chemistry test. So this test is done to detect any abnormalities in the body through blood. So for example, the doctor may order FBC, which is full blood count, to detect any abnormalities found in the patient's blood. Okay, so for the treatment, laryngeal cancer can be eliminated if they are detected early. The treatment depends on the type of cancer, the extent or stage of the tumor, and the precise portions of the larynx involved. Okay. The most common and desired treatments for most cancers, including this laryngeal cancer, are surgery, radiotherapy, and chemotherapy. So for early stage of laryngeal cancer, surgery or radiation may be sufficient to eliminate the malignancy. Even with somewhat bigger malignancies, this could still be the case. However, occasionally both surgery and radiation are needed. So for more complex surgery, may be required in later stages of laryngeal cancer. So, for early stages of laryngeal cancers, there will be minimal involvement of the larynx with small-sized tumors. So, these tumors can be treated with either one of the treatments mentioned. However, for more complicated cancers, it may need combined therapy. With minimally invasive surgery such as robot or laser, certain early tumors of the vocal cords and supraglottis may be removed through the mouth. Okay. For the advanced laryngeal cancer, they will have moderate sized tumors. So they will need combination of chemotherapy and radiotherapy used in the treatment. Meanwhile, for extensive cancers, surgery is the main treatment for cancers that have spread beyond the cartilage walls of the voice box or have obstructed the laryngeal functions. So we have various surgical procedures which are used to treat laryngeal cancer and at the same time preserve the functions of the larynx. In some extensive cases, surgeons have no choice but to remove the entire larynx in a procedure called total laryngectomy. So total laryngectomy is a procedure which separates the breathing and swallowing passages to allow safe and secure breathing. normal diet is resumed, but the patient will have to breathe permanently through an opening in the neck. So following a complete laryngectomy, patients have a few options for returning to speech, including voice prosthesis and electrolarynx.
Assalamualaikum and good morning to Madam Shamila. So now I will continue the presentation on what are the complications of larynx cancer. According to National Cancer Institute, complication of larynx cancer can be respiratory distress due to inflammation, cause blockage and narrow the airway, difficulty to swallow or dysphagia, poor intake related to difficulty to swallowing, weight loss, voice changes such as hoarseness sounds, and disfigurement of neck or face. Last but not least, the cancer can be metastasis, which is spread to other organs. Okay, so now I will present on what are the nursing management for patient with larynx cancer. The first nursing diagnosis is ineffective breathing pattern related to inflammation on surrounding laryngeal tissue, evidenced by shortness of breath. For the objective data, respiratory rate 25 breath per minute shows tachypnea, heart rate 111 beats per minute, this is show tachycardia. Then blood pressure is 135/92 millimeter mercury. For the oxygen saturation level, 93%, below the normal range between 95 to 100%. Then upon auscultation, produce wheezing sound. Patient look fatigued and anxious. Patient lips and show bluish discoloration, indicate poor oxygenation. So for the subjective data, patient complain having difficulty breathing past 15 minutes of before admission. Then patient also describe experiencing throat tightness and blockage before start to have shortness of breath. And then patient explain feeling of dizziness, tired and weak, estimately 15 minutes before experience shortness of breath. So for this diagnosis, the goal is can be divided into short term and long term. The first one, the short term goal is to improve respiratory rate from 25 breath per minute to normal range, and to increase oxygenation from 93% to 95 after 30 minutes of nursing intervention given. And then for the long term goal is prevent recurrent shortness of breathing during hospitalization, and to prevent complications such as pneumonia or respiratory distress. So for the nursing intervention, the first one, we assess general condition of patient to check sign and symptom of cyanosis. This is as an early detection to provide nursing care appropriately. Then we assess patient vital sign, especially blood pressure, heart rate and respiratory rate. This is as a baseline data to monitor and plan appropriate nursing intervention. And then we positioning patient in high Fowler's position, because elevating the upper body can helps diaphragm to descend and allow lung to expand and improve oxygenation. Next, we administer oxygen therapy as ordered by doctor. For example, 5 ml of oxygen supply to improve oxygen saturation of patient from 93% to 95 and gradually to 100%. This is the rationale of doing this is to improve patient oxygenation and prevent hypoxia complication and help patient to breathe normally. Then we also perform suctioning as ordered by doctor. This is to ensure clearance of airway by releasing out the excessive mucus secretion during the suctioning. And then we also teach and demonstrate deep breathing exercise to patient, because this exercise actually can improve oxygenation by expand the lung and help patient to relax. Then we also evaluate patient general condition, vital sign, respiratory rate and oxygen saturation. This is to evaluate the effectiveness of nursing intervention given and detect any changes and any abnormalities. Then last one, with documentation the nursing intervention and care given appropriately as evidence of nursing care has been given accordingly to patient. So for this diagnosis, the evaluation is patient's respiratory rate is reduced within the normal range in between 16 to 20 breaths per minute. The oxygen saturation of patient also increased as evidenced by latest vital sign chart is 98%. The heart rate is reduced from 111 into 90 beats per minute. Patients are able to breathe normally without feeling choke or block, and then no recurrent shortness of breath occur during the hospitalization. Then for the second nursing diagnosis, pain related to disease process as evident by swelling on the surrounding laryngeal tissue. Okay, for the objective data, increased heart rate 111 beats per minute and the blood pressure also 139/95 millimeter mercury. Facial grimacing or expression of discomfort is seen on patient. Patient also seen restlessness. Patient describe pain 8/10 using numeric rating scale. And for the subjective data, patient report pain while swallowing. Patient rate pain 8/10 using numeric rating scale. For this diagnosis, the goal is to patient pain's intensity will be reduced from 8/10 to bearable pain, which is decreases to 4/10 on numeric scale within 24 hours of nursing intervention and during the hospitalization. For this diagnosis, the nursing intervention is the first one, assess the location of the pain by checking the characteristic and severity of the site being complained by patient. Then this is actually the rationale for doing this is as a data to plan appropriate nursing intervention. Then secondly, we administer medication as ordered by doctor, such as analgesic. Example, Celebrex. This is to alleviate patient's pain and promote comfort. Then the third one, we monitor vital sign of patients such as blood pressure and pain score. This is as a baseline data to plan the nursing intervention given and record any abnormalities of patient. Next, we monitor the laboratory finding. Example, C-reactive protein test, because this test can check the progress of inflammation in body. Next one, we encourage the patient to find a comfortable position such as semi-foulers, because proper positioning can alleviate the pain, discomfort and reduce the muscle strain on the area of the pain. Then we also teach pain management technique by demonstrating deep breathing exercise to patient, because this can help patient to distract from thinking of pain while increasing the oxygenation, because during the exercise the lung will expand and this can promote relaxation on patient. The next one, we recheck general condition, vital sign and site of pain, because we want to evaluate the effectiveness of nursing intervention given to patient, and then detect any changes needed in the care plan. So the last one, we documentation the nursing intervention and the care given appropriately, because as evident appropriate nursing care has been given to patient. So for this diagnosis, the evaluation is patient's pain score is reduced from 8 into 4 after the nursing intervention given. Patient also verbalized pain is reduced. Okay, next let's move to health education for patients with larynx cancer. The first one is disease education. Provide information is to improve patient knowledge and understanding related to laryngeal cancer. This can educate patient about the disease, risk factors, signs and symptoms. This also can help to solve patient concern and question by provide open communication between nurse and patient, family members and caregivers. The caregiver. So for the second one, we discuss about the treatment option with patient because this can help patient to be informed clearly about the treatment option because patient with cancer, the treatment option may be vary based on the stages of cancer. So by explaining the goal for each treatment can help patient to make decision wisely. So for the third one is we also provide health education related to diet and lifestyle modification. This is because patients with larynx cancer risk to have difficulty swallowing. So nurse should encourage and suggest them to take bland or soft diet to prevent aspiration or choking while eating. Apart from that, patients with larynx cancer also should be advised to consume high-rich food such as fruits and protein because this can promote faster healing process. Then the fourth one is medication compliance. The nurses should provide health education by explaining the indication of drug, side effects of drug, and patient responsibility to while taking the medication. This can help patient to comply with all the medication has been prescribed by doctor. And then patient also need to be educated on detect the sign and symptom related to respiratory distress. This is to ensure early recognition for patient to seek immediate medical attention and prevent complication and to improve the outcomes. Then the last one, we give health education about follow-up management because we need to encourage patient to go for regular monitoring and check-up as scheduled. This can help healthcare provider to monitor patient progress and evaluate the effectiveness of the treatment plan. And that's so as a closure for this presentation, laryngeal cancer is a complex condition where abnormal proliferation occurs in the tissue of larynx, and then the exact etiology are still remain unclear. Researchers are still conducting research and study upon it according to National Cancer Institute. So effective intervention and health education should be taken to create awareness to reduce the number of laryngeal cancer around the world. So that's all for my group. Thank you.